Hello everyone, my name is Dr. Adenike Eketunde and you're watching Health Domain. Health is not just the absence of disease, it is a state of complete physical, social and mental well-being. On this show we'll be talking about health, lifestyle and general well-being. Today we'll be discussing about skincare and the topic is hyperpigmentation. It's going to be a very wonderful topic. We have a special guest today. She is a dermatologist and she has been doing it for over a decade, almost 2 decades, and I'm sure you're going to learn a lot. Don't go anywhere. Stay tuned. We'll be right back.
Hi, my name is Dr. Oputa and I'm a medical practitioner and specialist in aesthetic medicine, surgery and dermatology. My core focuses are anti-aging medicine and corrective skincare. So we want you to have the best skin possible. And we also want you to look healthy and to glow. When you're healthy, your skin is healthy, and that is where we start. We have loads of services available in our clinic, the most advanced aesthetic procedures to give you the best skin and to enhance you as an individual. My Instagram handle is derma_care. And then I have a website where you can read lots of information about health, wellness, and beauty. It's called drviv.com. That's Viv as in V-I-V, because my name is Vivian. So drviv.com. So this is how you can reach me. On my Instagram handle, you'll see my contact information as well.
Welcome back. You're still watching Health Domain. Like I said earlier, we have our special guest today. She's a very beautiful doctor. She's a dermatologist.
Hi, my name is Dr. Vivian Oputa.
Thank you for coming to our show today.
Thank you for having me.
And today's topic is skincare, hyperpigmentation to be precise. Can you tell us what the skin is all about?
Well-being involves the way you eat, the kind of lifestyle choices you may have, like recreational drug abuse, smoking, drinking alcohol excessively. These are things that affect the quality of your skin. Sleep and exercise are also major factors.
Okay, so can you tell us what is hyperpigmentation?
When you have parts of the skin that are darker than usual. And there are many different factors that are responsible for hyperpigmentation.
Okay, what are those factors responsible for hyperpigmentation?
Well, very commonly is the post-inflammatory hyperpigmentation as a result of assault or injury to the skin. Like if you're someone who is a pimple popper, you have acne and you just keep picking at your face, you notice that when it starts to heal, it leaves a dark scar, what we call the acne scars. So that's one form of hyperpigmentation. Then you can have them as a result of burns. If you have thermal injury, you will develop dark marks as well. Then there's some hormonal factors that come into play. There are conditions like melasma, then also in pregnancy. Pregnancy, the hormonal imbalances may lead to a stimulation of melanin, excessive production of melanin, giving you dark patches all over the body, not just the face.
Is it genetic?
It's not genetic. And you shouldn't also try to treat it during pregnancy. You wait till after you've had the baby before you treat.
Why?
You do not want to affect the fetus.
Oh, because of the drugs that is going to be used. Even the topical agents. Some of the chemical ingredients are absorbed into the bloodstream, so you do not want to harm the fetus. Yes. What are the causes? Can you just tell us what people do to increase their chances of getting hyperpigmentation to daily lifestyle?
Well, as I said, picking at your face, that's a very common thing. Sometimes, people develop hyperpigmented spots even if they don't pick at the pimples, for instance, or even pick at scars as a result of cuts or burns. So melanin is actually stimulated anytime there's a form of injury. Yes. So that's what happens. So
what do you do when you notice an hyperpigmentation on your face?
On your face, which is a common complaint in the clinic. Yes. Nobody wants to see the little spots. So I recommend, first of all, you come for a consultation so that you'll be treated right. Okay. Now, there are many ways you can address it. Sometimes simple exfoliation, if it's a surface pigmented spot, will help clear the spot. And eventually they will fade over time anyway. But then there are also agents we can use to bleach away the spots. So I'm not encouraging or advocating for bleaching. We're just talking about products. Well, the thing about hydroquinone, it's actually what we call the gold standard for correcting pigmentation. Now, hydroquinone is abused a lot. And people who have let me say, unsavory side effects are as a result of abusing the hydroquinone.
What are the side effects?
Well, we have a condition called ochronosis.
Called what?
Ochronosis.
Okay.
Where the skin becomes really dark, like soot, as dark as carbon. Yeah.
Are there certain skin types that are more predisposed to hyperpigmentation than another?
Yes. The black race. The more pigment you have, the more prone you are to hyperpigmentation. So a darker skinned individual will develop darker marks. Caucasians, for instance, will develop some form of pigmentation, but it's not as severe as in the black race, or say Hispanic, Asian, we are more prone, or it's more obvious.
Okay. As a dermatologist, when you're talking about treatment, you talk about bleaching the skin.
Yes, bleaching, therapeutic bleaching.
Therapeutic
yes.
bleaching. There's also laser and other treatment options. Can you just tell us more about it?
Laser is a bit tricky because if you don't get the right type of laser, you will worsen the pigmentation or even develop more pigmentation as a result of laser. For the bleaching creams, if you use it as prescribed, you should not have any problems. As I told you that with hydroquinone, ochronosis could be a problem, especially when it is the illegal concentrations of hydroquinone, not regular or acceptable concentrations. That's one. And then some people use steroids to bleach. You hear about steroid creams.
Yeah, yes.
Steroids are actually, anti-inflammatory, but a side effect is that they do bleach. The side effects of those is that they're harmful to the skin because they eventually thin out the skin.
Yeah, atopic.
Yeah, you've seen that, right? And then you have conditions where the skin becomes so thin that stretch marks develop in places that they should not normally. Like you could have stretch marks on the face if you abuse steroid creams.
Well, that's like the fastest way. People actually go for those creams.
Yeah, because they want to light up in 7 days or overnight. That's the problem.
So if you want to do that, the best method is to go to your dermatologist, check your skin type, and
yes, we will analyze you and determine what course of action is best to treat your problem.
So for people that don't have hyperpigmentation, how do they maintain their skin?
Then you use a moisturizer that's suitable for your skin. If you have additional problems, there are products you can add, like serums, and then also exfoliating, like scrubbing your face at least twice a week, I would recommend, but at most 3 times a week. And we're not talking about using sandpaper or scrubbing your face so hard that you stretch out the skin and age the skin. We want you to use gentle exfoliants for the face.
About sunscreen, can you just tell us what are the different strengths of SPF and how to know the one that is good for you? Yes.
Well, I would say sunscreen should be your last step in your daily routine.
Okay, so what are the different strengths of SPF and what is the recommended one as a dermatologist? Okay,
so now SPF means sun protection factor. And I would say a minimum of 30 should be used, and that's for everyone. But of course, if you burn easily when you're exposed to the sun, you should use higher numbers. You can do 45, 75, 100 even.
Is it recommended every day?
Every day.
Whether you're going out on the sun?
Whether you're going out or not. As long as there's daylight in your building or wherever you're going, even if it's raining outside, once there is daylight, you must protect your skin.
What are the home remedies
for
hyperpigmentation? Yes.
You really love the home remedies, don't you? Now, I'm not sure
how... People tell me, like, I use lime. Once I use lime, my skin is going to be...
I've heard about that. Yeah. You can also do a lot of research online. Because even if you don't have time, you can buy products. The same place you buy your lime, you can buy a face cream, right? So you can buy products. If you can't visit a dermatologist or you find it too expensive, you can visit my website. Because on my website, what I do is I give a lot of information that can help guide you as to what you may need. For me, it's about technology and using safe products or ingredients to give you the best skin.
Okay, thank you so much, Dr. Vivian. You've added from our mouth a lot about skincare and hyperpigmentation. We're still talking about hyperpigmentation. Don't go anywhere. We'll be right back. Welcome back. You're still watching Health Domain, and we still have our doctor here, the beautiful Dr. Vivian. So you're looking so beautiful. I've been admiring you since morning. And your skin is so wonderful.
Well, I try to practice what I preach.
Yeah, so talking about hyperpigmentation, bleaching, do you bleach?
Bleaching is so controversial. Do I bleach?
Yes.
Oh no, I don't. I've never bleached. I've never even tried to lighten my skin.
Is it as bad as people say it, or do
personally? Think about bleaching, right? There are pros and cons. I think I've mentioned before that we use bleaching to address concerns like hyperpigmentation, therapeutic bleaching. But then now you uniformly bleaching your skin. There are many reasons why people want to bleach. Maybe they have an uneven skin tone, or they have conditions such as vitiligo, where sometimes by destroying the pigment that exists, you're able to get the uniform complexion. So that's a therapeutic form of bleaching, as opposed to the cosmetic bleaching, which, as a matter of fact, Nigeria has the highest percentage of women that bleach, and a very high percentage of men as well, worldwide. Worldwide, Nigeria is known for that. But the unfortunate thing is that a lot of people use very dangerous chemicals to bleach.
So it's very bad.
That's where the problem lies.
Okay.
And then also the reasons for bleaching. We don't know what it is. Is it? We say sometimes it's about colorism, and you know what colorism is? It is when people within the same race discriminate against the darker skin-toned individuals. And that is what I think is responsible for bleaching. But some people say, oh, maybe it's because of racism, where they want to look like Caucasians.
Yes.
But I think it's more about colorism.
And people think they're actually more beautiful when they bleach.
When they're lighter skinned. Because they attract, the truth is, because we're a dark-skinned race, if you are light-skinned, you will attract more attention because you stand out to the crowd. There's no doubt about that. But what measures are you going to take? How far do you want to go?
What about
kill yourself?
What about people that are not bleaching? They said they are not bleaching, they are toning. What is the difference?
Okay, what people call toning is that it's not as extreme as trying to become white per se, but just maybe a few shades lighter. That's what I think people mean. But the mechanism of action is the same. The same enzyme that produces your skin color is inhibited by mild products as well as the very strong products.
Coming to the product, a lot of people use different things to bleach. The topical skincare and also injectable tablets, injections.
Topically, very common is this use of steroids. And steroids are anti-inflammatories, but the side effect, of course, is that they inhibit the enzyme, and some of them actually destroy the pigment-producing cells. So you're actually damaging your skin. Now, the downside for most products is that products are absorbed into the bloodstream from your skin. Many people don't know this. So I don't think anybody would bleach thinking that it's going to kill them. But that's a possibility if you use harmful products that are absorbed through the bloodstream and deposit in your vital organs like the kidney, the liver, the bone marrow, and will eventually lead to kidney failure and ultimately your death. I have a patient who called me of recent. She and her sister have been bleaching for more than 30 years and their kidneys are failing, the two of them. So this is a real problem. And if you lose pigment as well, you're more prone to sun damage. Sun damage will eventually lead to skin cancer, is a possibility. So if you're somebody who bleaches and you don't use sun protection, which many of them don't, because they go out and they fry. They even say, oh, my skin is burning when I go out in the sun.
And I think after a while, they don't even look good.
No, they don't. Because you're damaging the skin. The structural integrity of the skin is compromised. So in that situation, you lose the firmness, and then the supportive structures are destroyed. Who wants to have stretch marks from head to toe? That's something we see. And then you see stretch marks from head to toe are commonly seen. The skin gets really thin. You can see the blood vessels showing in some of the women. And if they require surgery, wounds will not heal in individuals like this.
Going to the causes of bleaching, I think as a doctor, do you think it's also psychological? Not just about
definitely. There's a psychological factor involved. Maybe an inferiority complex, or attention seek. I really don't. Is
there a way to prevent that? Is there like you have to go on social media and keep telling people you look beautiful, you can take care of your wonderful skin?
The thing is that if you have an identity crisis, or if you're demoralized and lack self-love, you should see a therapist. Do you understand? a psychiatrist can help you. I know people are afraid of seeing therapists in this country.
It's not as bad.
They feel it's stigmatized, but it's something that is a stigma. But you know, if you know, there's a condition called body dysmorphic disorder.
Yeah.
You've heard about that, where your mind tells you you're so ugly, even if you're not. So when you have conditions like this, I say practitioners should not capitalize on people's insecurities, because people can go to a doctor who might just decide, you know what, he wants this treatment, I'm going to give it to him. But if there's a deep-seated problem, that should be addressed first.
Okay. Can you give us tips and advice on how to have a very wonderful skin and to reduce hyperpigmentation?
I always say the best skincare starts from within. Okay, so what you eat, what you drink, how much sleep you get, exercise as well, all are factors that influence your skin. So it's not about just piling on products. Skincare goes beyond that. Then of course you have to get the products that are right for your skin type, and then use the products regularly, twice a day. I know a lot of people don't like the night care, but you know what? Night care is more important than daytime care. Excuse me. Because at night, the body works in exponents to deal with the stresses of the day, to deal with the environmental pollution. So products work better at night. And if we're actually treating people for conditions, it's the night care that is more important, because we get better results.
We're still talking about hyperpigmentation. Don't go anywhere. We'll be right back. Okay, it's time to debunk some medical myths about skincare. So the first one goes like this. Once treated, it's gone forever.
You know what? Whatever caused it in the first place, if that repeats itself, you will definitely have the pigmentation again.
Okay, so that's a myth.
It's a myth.
Or laser treatment for hyperpigmentation will work, because a lot of people find it very difficult to cure acne and hyperpigmentation, and they feel, oh, if I go for a laser treatment, I'll be fine.
It's still not enough, because first of all, for acne, you know, there are many different factors that influence development of acne. So if you don't address all of those, you can keep treating and you will keep coming back.
Okay, so laser treatment is not the gold standard for...
No, definitely not.
Okay.
And it's very expensive. We have skin transformation packages for dealing with acne, and then also lifestyle choices and information as part of our packages. These are things also. There was a very good article I have on my website. It's called Acne. Not all breakouts are created equally. So it goes in depth into different causes.
What's the name of your website for our viewers?
drviv.com. So that's doctor spelled in full, then viv.com. Yes.
Okay. Is hyperpigmentation genetic?
I wouldn't say it's genetic. It's well, some people are born with darker patches. If you've in that situation, you see children born with moles or pigment that covers even like half of the face. So that is something that they're born with. But being prone to hyperpigmentation is as a result of the assault or injury or exposure to the sun.
Okay. Also, another thing is black don't crack. The black skin don't need sunscreen.
You know what? No, black skin needs sunscreen, so that's a myth for sure. But the fact that black don't crack, I agree with that. Especially if the darker you are, the less prone you are to sun damage, and sun exposure is probably the leading cause of aging. So if you're able to protect your skin. Well, of course, because we have melanin. The melanin activity in the black race is more active than in lighter skinned individuals, like the Caucasian race. But we all have the same number of melanin producing cells. Because of our activity, it's created to protect us more from the sun. And that is why we don't age as fast as Caucasians, for instance. That explains it.
And we don't need more sunscreen like them.
You need sunscreen. Nobody should try to avoid that step, because that's the question I get all the time. So I'm dark, I don't need
well, actually, a lot of people don't use sunscreen.
They don't, but we should encourage them.
Yes.
Because of the protective benefits. We're thinking about the premature aging as well as development of skin cancer, which could be deadly.
Okay. Another myth is that while treating dark spots, you can't do it without bleaching.
Well, as I said, you could use exfoliation techniques like a chemical peel or scrubbing. If the surface, if the pigmentation is surface, then it could help to fade it gradually over time. But you could use agents to bleach them away if you want more rapid results.
Okay.
And if it's deep.
Thank you. Another myth is that you only need sunscreen when you're going under the sun. If you are going to be indoors throughout the day, you don't need sunscreen.
You need sunscreen all the time, every day. And you should also note that sunscreen only lasts you 2 hours. So you only have 2 hours of protection. So in an ideal world, you would reapply. And when we're talking about sunscreen, it's not just to the face. Any part of the body that's exposed. So if you're wearing short sleeves, you have to wear the sunscreen on any skin that's exposed, even on your legs.
Talking about hours of sunscreen, you said it's only effective for 2 hours. What if you're using your makeup?
That's a good question. Now, the good thing is that there's sunscreens created in translucent powder form. So you can now dust that on over your makeup.
So that is a very good way of preventing yourself from the sun.
Yes, well, at least some good protection.
Thank you so much, Dr. Vivian. I hope you've learned a lot today. Until next time, keep watching Health Domain. Bye.